Hey there, in this video I want to talk about knee pain without surgery. Hi there, this is Boon Wei, your exercise physiologist. So I've been asked quite a number of times regarding this matter, and I thought maybe I should just put up a video to just, if you happen to watch this, then at least you get yourself educated, because not all knee pain requires surgery. This topic has been around for the longest time. Everybody will say, oh, there's some knee pain, there is some degeneration, you need to get it fixed, you need to get everything in there brand new so that you won't feel the pain anymore. The thing about this is, we don't even have to get there in the first place. The first thing is, how did you actually get the knee pain? So let me just break this down so you have a better understanding. I've put up a video earlier on to show you that there are actually a lot of structures around the knee. It doesn't mean that if you have knee pain, you have to have surgery done, because this structure is already one of the reasons why you have knee pain. So then comes, how did you actually get the knee pain? You may have some accident. It could be, somebody bumped into you and then you try to break the force, you try to balance, and then you felt something. Or very commonly, people in the sports, they were doing some jumps, they land, and then they felt something. It could also be sudden acceleration, where you, usually on sports athletes, when they try to change direction very quickly, they feel something. And then there is one that is, you don't know what happened. Once in a while you feel pain, you just don't care about it. And then as it gets, over time, you start to feel even more. And this is the one that everybody talks about, which is also like chronic pain, degeneration, wearing out of gel, and this kind of things. Something that nobody talks about, and the degeneration that is happening, is the muscle. So they talk about, could be meniscus, could be cartilage, could be the bone. All this can be scanned and they can show you on the imaging, right? And so sometimes you say, oh, I have knee pain on my right, and you go for a scan, could be x-ray. X-ray, they can't find anything, but you still have the pain. Okay, then let's go for more scans. X-ray, right? Then now we go for MRI. Now, MRI, you feel you've actually found something. Okay, and then very commonly you'll be asked to go for surgery. And if you insist not to, then there will be some other kind of treatments. There could be some injection. There could be most of it comes from injection, and you need to find out what they're injecting. Some what they call PTP, some plasma treatment. So what they want to do is they want to make the cell regenerate in there. The other one is steroid, which is not very common now, but some doctors still use them depending on the condition. And those are the more common treatment that you get. The thing about muscle, back to muscle again, is that there's no test. There's nothing to quantify that, to say that, hey, actually there is something wrong with the muscle. And the only thing to test this out, usually, my question to people who come to me is whether is it on both sides of the knee. Usually, only one side. So then my question would be, you were told that it is degeneration. And so how come both knees are of the same age? Because you can't be born 1 year later, right, with one leg and then the other. And then you have a degeneration on one knee, but not the other knee. So that is one of the questions that I asked. The other question, something that you may want to also ask yourself, the other question that I ask is, in what action, in what movement, or how do you actually replicate the pain? Because this is very important. If you know how you can replicate the pain again and again, this tells me something. This tells me that this movement can cause pain. And when movements get involved, you cannot say that the muscles are not involved. Something that I also ask in addition is also, when there's no movement, when you are seated down and not doing anything, do you feel pain? And most of the time, it's a no. So then comes my question. If it is a structural problem, so think about a brick or something that you know has chipped off or wear off. If it is that problem, isn't it supposed to give you the pain while you're not doing anything? The thing is, they're not feeling pain when they're not doing anything. So how can it be that when the structure is wear off, is degenerated, but it's not giving you pain when you're just not doing anything? So there are a few, these are the common questions that you have to go through, you have to think through as well, because you most likely don't know, and you happen to see this, then that's good, at least you now know, and you have to go think about it. Because when movement gets involved and you try to eliminate and you try to do, or you question yourself, the question that I asked earlier on, most of the time it's going to be muscle. And I've seen so many cases where when we do rehabilitation, the pain goes off. Now, the degeneration comes from the muscle because after the age of 30-year-old, everybody's muscle will start to degenerate or atrophy. And that's why when you look at athletes, no matter who you look at, they start to get slower every time when, past the age of 30-year-old. Especially with sports where it's very physically demanding, where they need to be running, sprinting, jumping, you will see the performance dropping, because although they have been training, every day, the muscles, this is human biology. There's no way that you can change this. You can slow it down, but you're just gonna get slower. And that's why most of them, they will retire at age 34, 35, move on to other sports or move on to, doing other things in life, because there's no way to compete anymore once they pass that stage, right? So muscle over here, it does get degenerate, and it again then depending on how you were moving previously or running. For some people, they may be getting it, getting one side of the body, the leg, to be doing more work and the other side not. So then this one side has been overloaded in a sense, and it just gets into trouble over time. So it doesn't mean that knee pain requires surgery. I really hope that this video helps. Please do share this. Please do let somebody is having this problem, because surgery is usually not the very first recommendation for everybody. There are risks involved, so something that you want to think through as well. If you know somebody, let them know, share this video with them, and if you have any other questions, please put on the comment section below. And if you like my video, if you like my work, please subscribe. And if you want to find out anything else, also do drop me a comment so I know what other videos and what other things I can share over here. Yep, so please take care. I will see you again. Bye bye.